So I'm Scarlett and I'm in the Community Arts Practice course at BRIT School. It is currently June 2020 and we are approaching the end of the first lockdown stage due to the coronavirus epidemic. I wanted to make this video to kind of share my thoughts on what relevance CAP can hold during this period and what we could do. So before we knew it, the UK plummeted into full lockdown and a national health crisis.
Sweeping and extraordinary measures to deal with coronavirus, the forced closure of pubs, restaurants and gyms, and an unprecedented rescue package for workers and businesses. Life in our public places is shrinking out of all recognition as the Prime Minister pleaded with people to stay at home.
You could only go to shops if it was necessary, you could only get on transport if it was necessary. Shops around my entire borough was closed, and along with the schools. So how did various bodies and institutions respond to this? Loads of people responded imaginatively to the issues that lockdown brought. These were things from art classes coming online, different types of music also got streamed online. David Hockney, an artist, even gave an exclusive exhibition over lockdown. School lessons became virtual, even music lessons became virtual. Everyone had to readjust. So the question is, how can CAP, my Strand Community Arts Practice, respond and what can it do to help? So during lockdown, I took part in a few online virtual workshops with people with additional educational needs. For example, the White Horse Community Hub in Croydon, and they were absolutely brilliant. They were super effective. I loved them, and it was clear the participants also really benefited from it. These were some of the screenshots that we did with White Horse Community Hub. So my proposal comes from an article that I read on The Guardian at the beginning of this month. The article concluded that 10,000 people in April alone, those living with dementia, died, but in addition to the numbers that died from the virus. So these people didn't die from the virus, they died from the lack of medical visits, lack of family visits, but overall being isolated, and as the article put it, them shutting down. So in the article, they talk about the severe impact that social isolation has on people living with dementia, and they go on to talk about the statistic that there were 83% of more deaths from dementia this year in April compared to other years, which show the effects of social isolation on these people. They also talk about the findings of a survey that show that out of 128 care homes, 79% of them report that the lack of social contact is causing deterioration in their health and well-being of the residents that are living with dementia. So could we extend the entire virtual workshop approach to those living with dementia to end this issue and the sense of isolation and depression that leads to deaths, which the article highlighted? So this obviously would have been more appropriate to do during this lockdown, but we can adapt the exact same principle and apply it to future crises, or if there is a second lockdown, or if things don't go back to normal for those at risk straight away. This lets us be more prepared for the future. So in summary, CAP's role could move from being a vital part of the country's approach to education to being an integral part of the government's public health policy. So perhaps this is something that we can develop and work on in the coming months, but thank you for listening.